All right, guys, welcome back. Let's do another live question and answer session. I have Ella here with me. She's going to be relaying the questions that you guys are currently typing away. And of course, for some of the people that can't join us, we're going to be reposting their questions and answers, I think on Saturday or Sunday. But anyways, let's get going.
Perfect. What is a bra line backlift and who is the ideal candidate?
Yeah, great question. So a bra line backlift is a procedure to excise excess skin and soft tissue off the back and tighten up the back skin, basically eliminating bra fat and bra rolls. You can think of it like a tummy tuck for the back where the final incision is in the horizontal part of your bra strap. That's what a bra line backlift is. You can also call it an upper body lift on the back area. There's lots of different ways to do a bra line backlift. I co-published that procedure back in 2008 with a plastic surgeon by the name of Joe Hunstead. He has since retired. Of course, over the last 17 years, I've modified the bra line backlift to perform better, to give better contour, to be adaptable to more patients, to eliminate more tissue, to create better contour. The patients that are the best for a bra line backlift are the patients that have loose skin on the back. And loose skin on the back usually results in some kind of rolls and folds in the bra area or just below it. However, there are some patients who don't have strong ligaments in the back and they have a lot of loose skin in that area, but you can't tell that the loose skin is there because they don't have those folds, because they don't have those strong ligaments. However, when you generally look at their back and their waist, they're kind of boxy. And it's important to diagnose that because those patients are still great candidates for a bra line backlift because they want to get a hourglass shape. And if you don't properly recognize that they have loose skin in the back, you'll basically only treat the front part of the waist and the waist won't be as contoured. So loose skin in the back with or without folds in the bra area are the patients that are the best candidates for a bra line backlift.
In a virtual consult, are you able to tell what is fat versus what is loose skin after a major weight loss?
Let's repeat that question again because I was messing around with the microphone.
Yeah, so in a virtual consult, are you able to tell what is fat versus loose skin after massive weight loss?
Well, it's obviously better in person to pinch, but it doesn't make any difference, right? So if you have a lot of weight loss, you'll automatically have loose skin. And whether that loose skin has some fat or a lot of fat underneath it, it doesn't make any difference because you're not going to do liposuction to an area that has loose skin. You're just going to get even more loose skin. So the standard treatment or gold standard, the best treatment for people that have lost a lot of weight, have had massive weight loss, and now have contour irregularities is going to be some type of a skin removal procedure. And whatever fat's underneath that skin also gets removed. So obviously, with my experience of 17 years, I can do a pretty good job of telling how much of it is loose skin versus how much of it is fat, even virtually. It's obviously better in person, but the reality is it doesn't change anything. If you've lost a lot of weight and you have a lot of loose skin and that loose skin has created contour irregularities, you have to remove that loose skin through a tummy tuck for the abdomen or a bra line backlift for the back, arm lift, thigh lift, etc. And once you're doing an excisional skin removal / skin tightening procedure, you're automatically removing both the skin and the fat that's underneath it.
Perfect. Next question. Do you perform 360 lower body lifts? Does it help with saggy thighs?
Yeah, I do perform 360 lower body lifts. So there is a couple of different ways to discuss and define what a 360 lower body lift. The traditional 360 lower body lift is a tummy tuck for the front because you're removing the loose skin from the abdomen. It doesn't really do that much to the thighs. There's a little bit of pull on the front upper part of the thighs, but not anything on the inner thighs and not anything on the outer thighs. Now, that's just the front part of the 360 lower body lift. The back part of the 360 lower body lift, the tummy tuck incision continues and joins with a incision that is right where the buttock area joins the lower back. So both the front incision and the back incision are in your bikini line. And that is what the traditional 360 lower body lift. Now, the back part of the incision only lifts up on the butt area. It doesn't lift on the back of the thighs, but it does lift up on the outer thighs, like on the hips. So a 360 lower body lift really takes care of the front of the waist, the tummy tuck. It takes care of the outer, or what we call lateral thighs, like the hip area, and it takes care of the buttock area. Now, loose skin on the inner thighs needs a thigh lift.
Can you do multiple procedures at once?
We can, and in fact, that's our most common surgery, is multiple procedures at once. It doesn't have to be multiple procedures at once, but we can, and that's our kind of a standard go-to, because most patients that come to us have multiple issues or multiple concerns, and they can combine those procedures safely and effectively without having multiple downtimes. And the most common combination is usually a plus-size tummy tuck, a bra line back lift, and some version of a breast lift or a breast reduction. Of course, a breast reduction includes the breast lift.
If you've had 4 C-sections, can you get a tummy tuck? And the follow-up to that is, how long should we wait after the last C-section?
Yeah, so a C-section is usually done with a fan and steel incision, so it's a horizontal incision just above your pubic area. When we do a tummy tuck, I prefer to put my incision very low, and that automatically removes the prior C-section incision, the prior C-section fan and steel incision. Now, obviously, some women have a vertical incision for a C-section for various reasons, but that's usually below the belly button, and then so obviously that also gets removed as well. In the event that obviously there's not that much loose skin and you have a vertical incision, and that vertical incision is all the way up to your belly button or maybe even beyond it, then most of that incision will be removed, but maybe some of it will remain. You can get a tummy tuck at any point after having a C-section, but I do recommend waiting for your body to kind of recalibrate with all the hormones and the inflammation and the skin retraction. So I would imagine that you'd want to wait at least a couple months. That also gives you a chance to really dial in your personal situation at home with a new baby and the obviously the domestic circumstances. But the C-section is usually not an issue. I have not run across a situation where that's been an issue for getting a tummy tuck.
Can you fix a softball-size ventral hernia while doing an abdominoplasty?
Yeah, I can, and I will, and that's and I do so without using a mesh. If you go on YouTube, and even if you scroll back to our Instagram post, you'll see that we've done quite a few ventral hernias and umbilical hernia repairs at the same time as we've done either a tummy tuck or a plus-size tummy tuck. And you can see some of them are softball size hernias. So yeah, we can certainly do so, and we've done so in the past.
If you've had a tummy tuck years ago, would you be able to get another tummy tuck?
Yeah, you can redo the tummy tucks. Obviously, you can redo them by excising more skin. You can redo them by adding a different dimension to the skin removal, either by doing a vertical incision to pull inward. Some people may be a candidate for a reverse tummy tuck, where you make an incision underneath the breast fold and you pull upward. You can liposuction the abdomen. You can go back in and repair muscles or re-repair muscles if needed. So yeah, you can definitely redo a tummy tuck.
How do you sculpt the waist so that the tummy tuck shows off an hourglass waist?
Well, that's a great question. And that's basically what a lot of patients really want, is they want the hourglass shape. And so there's lots of different ways to do that. And the good news is I include all of them in my tummy tucks. That's why when you look at the before and after photos for us, I think you'll agree that most of our patients substantially improve their hourglass shape with a tummy tuck. And I include all the things that I know how to do that your body and everyone's body that's getting a tummy tuck allows me to do. The things that I can't really control is intra-abdominal fat. That's fat on the underneath the abdominal muscles on your organs. And for obvious reasons, I can't take care of intra-abdominal fat because obviously it's on your organs. And that needs to be addressed, and it can be addressed before, during, or after your tummy tuck. The good news is that if you have a lot of intra-abdominal fat, but you still need a tummy tuck and you get a tummy tuck, you can continue to work on that decreasing of the intra-abdominal fat on your own. And it usually just involves not consuming things that are absorbed quickly through your GI tract. So sugary drinks, alcohol, processed foods, sugar, that kind of stuff. And you can lose that intra-abdominal fat without negatively affecting your tummy tuck results.
Are you board certified? Also, where are you located?
Yeah, so we're located in Scottsdale, Arizona. I am a board certified plastic surgeon. I'm board certified by the American Board of Plastic Surgery. So what that means is that in order to be board certified by the American Board of Plastic Surgery, you have to go through a formal residency program, which is 6 years long. You also have to do a full written exam and then a 2-day oral examination on a combination of cases that you've performed in practice, but also a combination of cases that are what they call unknowns, basically like kind of like surprise scenarios. So it's a pretty rigorous process to make sure that you're properly trained, technically sufficient, good decision maker, and then you have good ethical behavior, so that obviously you're not making decisions that are unsafe to your patients. So very rigorous process to become board certified plastic surgeon by the American Board of Plastic Surgery.
How would I know if I needed a plus size tummy tuck versus a paniculectomy?
Yeah. So a paniculectomy just removes the tissue that overhangs your pubic area. So as you look in the mirror and you can put your hand underneath your pannus, the tissue that overhangs your pubic area, if you then put your hand on top of the pannus and you kind of try to match up with those two fingertips, then that tissue gets removed. But a paniculectomy traditionally does not dissect up and remove more tissue or reposition the belly button or do muscle repair or do liposuction. It's usually just kind of a wedge excision of the tissue that overhangs the pubic area. So if you're just trying to get the tissue that's overhanging your pubic area removed, then a paniculectomy would work fine. But if you try to maximize the shape of your waist in terms of the skin contour, the muscle repair, the liposuction, the pubic lift, all that stuff, then it's a plus size tummy tuck that you're looking for.
Can you just explain your pricing?
Yeah, so obviously if you have surgery, there's going to be a cost for the surgeon, there's going to be a cost for the anesthesiologist, and there's going to be a cost for the operating room. And those three costs are estimated based on time. So let's envision two people, and one person wants a plus size tummy tuck and they're 5 foot tall, and the other person wants a plus size tummy tuck and they're 6 foot tall. And so obviously the length of the incisions are longer, the amount of liposuction, let's assume they're different. And so overall, the more work required for the taller, bigger person is going to be a higher number of hours in the operating room. So therefore, the surgeon's fee, the operating fee, the anesthesia fee all are higher for the bigger, taller person that's getting a plus size tummy tuck as opposed to the shorter, smaller person. So all of our pricing are hourly based, and that's why they're fully specific to each patient. That's why we don't have a specific, on our website, look at this procedure, and therefore that's the price, because it will never be appropriate, because they all are always customized specifically for each patient based on where they are starting and where they are trying to go.
For out-of-state patients or out of the country, how long should they stay in Scottsdale?
We recommend out-of-state patients or out-of-the-country patients to be here for about 2 weeks. The reason for that is it gives you a chance to kind of recoup some of your energy, gives you and I a chance to see each other at least a handful of times before you head back to your home state or your home country. It also gives us a couple of weeks to really refine the compression garment. Maybe your swelling goes down a lot. Maybe we go into a smaller compression garment, or small things such of that nature. So 2 weeks is a good time frame. Longer is better, but 2 weeks is a good time frame. Now, we do have some patients that can't stay a full 2 weeks, so they shorten it by, let's say, half a week, and they end up staying here for about 10 days. That's fine too. It's all worked out great. But as you can imagine, it's a slippery slope, and the more you reduce that time frame, the more difficult it is for you to recoup that energy, and you start missing out on some of the post-operative appointments.
This person is wondering if they should get a tummy tuck done prior to a BBL surgery, or if there's a reason between, picking one over the other.
Yeah, I don't have a preference either way. I don't have a problem doing a tummy tuck and a BBL at the same time. Obviously, you're going to have to lay on your back because of the tummy tuck. You can't lay on your front. And so some people then say, well, if you're doing that, it's gonna be deleterious to the BBL fat transfer. But I have not found that to be the case. I've done tummy tuck BBL combinations my whole career, and the BBL has done great. So it's up to you. But if you're wanting to, kind of be as careful as you can and definitely get the tummy tuck first. And the reason for that is that when you do the BBL, then you automatically have to get the fat from somewhere, so you can do a little bit extra liposuction. So you get the benefit of additional liposuction if you stage the tummy tuck and the BBL. But if you're trying to have one recovery, then certainly just get the tummy tuck and the BBL at the same time.
Do you do muscle repair when you do a tummy tuck?
Yeah, I always evaluate the abdominal muscles during the tummy tuck, whether there's a hernia there, whether they're separated, whether they're loose, and I automatically include that. I don't use any mesh. I just simply use suture to reapproximate the muscles back to where they used to be.
This person's wondering why you do the scar along, like why specifically you do the bra line backlift like that scar.
Yeah, so the bra line backlift procedure is designed to remove skin in the kind of upper to middle back, to remove loose skin and loose folds and bra fat in the bra area, the horizontal part of the bra area. And when you do so, it makes the back smooth, but also creates a more hourglass shape. It complements the waist shaping that the tummy tuck does in the front. So the bra line backlift and the tummy tuck work really great together to create that hourglass shape. You can put that incision kind of in a lot of different places. It naturally wants to be in that horizontal part of your bra strap, and it's also well hidden in that area. Now, it is possible that some people may want that incision to be lower or potentially higher if they have specific preferences and certain types of clothing, and I can adjust that incision to be a little bit higher or a little bit lower. But as you can see, for most people that have a lot of loose skin, that loose skin kind of wants to go back up and be excised kind of in that horizontal bra strap area. Now, it's variable. It can be a couple of inches higher, a couple of inches lower. And I do customize and adjust that based on where the person's naturally wears their bra strap. The other caveat is where the person wears their horizontal bra strap is where they wear their bra. And that is impacted by how big their breasts are and how maybe low position their breast is. So as I do a breast lift or a breast reduction in combination with the bra line backlift, I adjust that position of the horizontal part of the bra line backlift incision because the person's bra position is probably going to go higher with the new breast position.
Do you only work on overweight patients?
No, we do work on everyone. Yeah. So obviously, when I first started, I was doing kind of a traditional practice where most of my patients were, a BMI below, let's say 40 or below 35. And of course, over the last 17 years, as I've dedicated to develop and refine the plus size tummy tuck procedure, the BMI potential of that procedure has increased. Our highest BMI today has been 88. But I would say still maybe 25% of our patients are normal or lower BMI, whether in their 30, 35, BMI. And of course, some of our patients are in their 20s and even low 20s. And so that's, we have no weight or BMI requirement, and that includes, too low or too high. I mean, the only caveat is that if you have too low of a BMI, that might indicate that maybe you're a little bit malnourished. And so then we would want to make sure that we would evaluate you for proper healing. But we have no restrictions. And we certainly still do quite a few patients that are, quote unquote, normal BMI.
If someone has already had a hernia repair, will you still do a tummy tuck on them?
Oh, yeah. And a lot of our patients have. And then some of our patients, when we do the tummy tuck, not for all, but some of the patients we find the hernia maybe has been insufficiently repaired, or maybe they have a second hernia or things of that nature. So yeah, absolutely.
Will you do a plus size tummy tuck on a patient after they've already had a quote unquote messed up paniculectomy?
Yeah. So you have to remember that so that short answer is yes. And then also as a longer answer is, you have to remember that I started my practice fixing other people's tummy tucks. And the reason for that was I co-wrote a textbook called Atlas of Abdominoplasty with a plastic surgeon by the name of Joe Hunstead. I mentioned him earlier. He's since retired. And in that textbook, we're basically writing a textbook for other plastic surgeons to kind of review all the things that are pertaining to tummy tucks, including revision tummy tucks, fixing complications, fixing maybe unideal tummy tuck contours. And so that also then applies to paniculectomies and things of that nature. So there's not been yet one patient who has had a tummy tuck elsewhere or paniculectomy elsewhere, and they've had maybe an inappropriate procedure or maybe a poor aesthetic result that I have not been able to address, fix, and make it significantly better.
Do you do reverse tummy tucks for loose skin?
Yeah, we do. I would say maybe about 2 patients per year are good candidates for reverse tummy tucks, and so I end up doing about 1 or 2 patients per year. It's pretty uncommon to be a great candidate for a reverse tummy tuck. Most people are a better candidate for that traditional pull down approach, especially the heavier patients. But there are patients who the reverse tummy tuck is a great option for them for a lot of different reasons. And then so I have done that. That's actually one of the chapters in the Atlas of Abdominoplasty. And in fact, when we wrote that textbook, there was basically no information on the reverse tummy tuck. So that's kind of when we, defined the reverse tummy tuck and described some of the details in terms of who's an appropriate candidate, how to best do it, and then modifications to it.
What does it take to be a good candidate versus what would disqualify you?
Well, I don't have a BMI or a weight restriction, so that will never disqualify people. The things that obviously the safety is the most important part. We always want to be the safest that we can, and that's why we've never had a death in our practice. The vast majority of our patients heal perfectly without any additional intervention. And so we're always looking for safety. And that's why we have a fully licensed Class C surgery center. That's why we have great staff, a board-certified anesthesiologist. That's why I'm a board-certified plastic surgeon. That's why my facility is across the street from the hospital if we should ever need it. So as you can see, we've crossed our T's and dotted our I's for the safest possible way forward to do all of our procedures, including the plus-size tummy tuck. So the patient that comes in that it cannot successfully get a safe procedure, then obviously that would be the exclusion. And that would be primarily with people that have very poor heart function and very poor lung function. I suspect there might be others, but that's kind of probably the most important part. If your heart and lungs are barely scraping by in terms of function, then obviously they're not going to be doing well during anesthesia and the post-operative recovery period. But beyond that, there are really not a ton of other disqualifications.
And this will be our last question. How do we get a consultation with you, whether we're in state or out of state?
Yeah, absolutely. So you can just message us here on Instagram. Ella and the rest of my staff will help you with that. TikTok, we're on there. You can message us on there. We have 2 websites, drrepta.com as well as plussizetummytuck.com. There are little virtual consultations at the top. If you ever want to give us a call, the kind of the traditional old-fashioned way, our phone number is 855-377-3782. My staff will be happy to help you with that as well.
Perfect. Thank you so much.
All right, guys. Until next week for our next live Q&A. Have a great day.